A COVID patient has landed himself in a Sydney hospital after overdosing on unproven treatments, including the anti-parasite drug Ivermectin. Instead of a cure, all he got was a self-inflicted bout of diarrhoea and vomiting. He's since returned home, but health authorities are warning people not to source their own treatments online.
Make sure that you've getting your healthcare provided by a healthcare practitioner, and that you seek advice before taking any medication.
Chris Freeman is a pharmacist but also president of the Pharmaceutical Society of Australia and has seen the demand for the controversial drug rise. He joins us now to discuss it. Chris, let's just clear this up, shall we? Does Ivermectin cure COVID?
Well, I want to be very clear for the viewers at home tonight. There is no reliable evidence that shows Ivermectin either prevents COVID from occurring in a person or treats it. In fact, there was a study that reviewed all clinical evidence recently that looked at Ivermectin use in COVID-19, and it found that there wasn't enough evidence to support its use in terms of its efficacy.
Now, Chris, just to be clear, there's a human version of this drug, but there's also an animal version that people can seek out.
That is correct. So we've had some people come into pharmacies recently with prescriptions for Ivermectin, but as you said, we can also get this veterinary product. The challenge with the veterinary product is it's not for human use. So the doses are very different, the formulation is very different, and someone taking veterinary Ivermectin can actually take overdoses very easily.
Chris, I understand that you're sitting here in front of us and you're telling us that it's potentially dangerous, but you've got a battle on your hands, right? Because Joe Rogan, who has 13.1 million followers, he got COVID a few days ago, told us he took a cocktail of drugs, one of which was Ivermectin, and he said, I'm feeling heaps better. How dangerous is that type of stuff?
Yeah, that advice is at best dangerous, at worst lethal. And we've heard cases already where people have overdosed on a cocktail of medicines trying to cure COVID. I can understand how people get anxious about getting COVID and wanting to do everything that they can to prevent and treat it. But we do have a good prevention here in Australia, which is the vaccine. The TGA has approved a new treatment for COVID recently, and so we do have approved treatments here. It's not like they don't exist.
We know that the Health Department, you mentioned the TGA just there, but the Health Department's also looking at all kinds of treatments for COVID, and they have been for a long period of time. Do you think we might soon see a day where someone can walk into a pharmacy and get a drug that does actually treat COVID well?
We've got a great system here in Australia with the Therapeutic Goods Administration being able to look at new medications for emerging diseases. And so we have recently, just this month, had a new medication approved for the treatment of moderate to severe COVID to prevent people going on needing respirators and those sorts of things. So we've already got one approved, and I understand there's 4 or 5 in the pipeline that are currently being assessed from the TGA. So these things are already in Australia, and as soon as they're approved by the TGA, they'll be being utilised.
All right, Chris, thank you very much for your time.
Thank you.